Good evening, everyone, and welcome to Have a Seat with Chris Hansen on my YouTube channel of the same name for another special edition of our COVID-19 reporting tonight. The numbers are staggering as we start to hit the peak of this pandemic across the country. In New York City, in the last 24 hours, 731 deaths, New Jersey, 232, and here in Michigan, where I'm sitting right now, 118 deaths in the last 24 hours. We have in one hospital system here, the Detroit area, 1,500 employees who have tested positive for COVID-19. We have an incredible set of guests tonight, and I'm very excited as we explore how this is affecting our society from coast to coast. Dr. Suraj Saggar from the Holy Name Medical Center in New Jersey, just across the river from New York City, is going to be with us tonight. We also have the Detroit Police Chief, James Craig, who I've known for many years, who himself is at home tonight, leading his department from home as he recovers from having COVID-19. And we'll talk to him in just a few minutes. Vincent LaVien of the Emergency Management Task Force in New York City, and with everybody on the internet, in every home in this country, around the world, really, we'll talk to Alicia Kozak, who is an internet safety expert and an abduction survivor, about how to keep your children safe online and how to keep yourself safe online. Let's jump right in with Dr. Suraj Saggar of the Holy Name Medical Center in Bergen County, New Jersey. Doctor, thanks so much for being with us tonight. I can only imagine what your day was like, what your 3-4 weeks has been like. Describe the scene in your hospital today.
Yeah, thanks for having me, Chris. I appreciate it. Just to, keep awareness for the public of what's really happening. Since we last spoke, it's really just incredible in terms of the amount of cases we've seen, the acuity. So that means how sick these patients are. We'll start with some good news first before I dive into the reality. We have been able to refine how we identify these patients. And we know it's a spectrum of disease. So some patients are very early, and that's where we really want to intervene. So we keep refining our protocols in terms of how we treat them, which experimental medications we're using, which clinical trials we're fortunate to be a part of. And so I am happy to report that we are able, if we intervene early enough, have discharged close to 100 patients from the hospital and kept many more times out of the hospital. Now, having said that, we know that patients that oftentimes are staying at home, or perhaps for various reasons, obesity, diabetes, heart disease, older age, immunosuppressed, etc., have much more rapid declines. And that's what we expected, and that's what we've seen since we last spoke. And that's now equated to, well over 40, 50 patients on the ventilator. Our hospital has transformed, as many hospitals in the New York City tri-state area, New Jersey, Connecticut, and Long Island, in terms of really having to expand their capabilities. You've heard about the pop-up hospitals in Central Park, the Mercy Army Hospital in New York Harbor, pop-up hospitals in New Jersey. Our own institution, we've had to take whole areas of the hospital and transform them into ICU. So it's really, we use these words unprecedented, but truly is unprecedented in terms of what we've all seen as healthcare providers. And we have to constantly keep, as you know, I've described it as a race. We have to constantly keep ahead of it.
Are we at the peak, doctor? Are we almost there? Can we say anything positive tonight about what's happening, what you're seeing in your hospital?
Yeah, I think it's important for everyone to realize that a model is just that. It's a model, it's a prediction. We don't know for sure. What we can say without hesitation is that social distancing, mitigation, right, staying indoors is working. We look at different things like the number of case fatalities, and they may sometimes lag behind the new cases. So we look at the new cases coming in, we look at how many people are dying, the case fatality rate, and we can see at least glimmers of good news. It doesn't mean it's all of a sudden going to disappear, but we at least see glimmers that if we can slow down that curve, then flatten that curve. And again, I should caution everyone, flattening the curve does not mean it instantaneously drops down precipitously. It may flatten and plateau for a long period of time, but we're at least seeing early evidence that social distancing does work. We cannot become complacent, however. And in terms of the actual models, everyone wants to know what's the date when everything will go back to normal. When can we open up the country? We can open the economy. That is it really has to be a wait to be seen. These models work best when we have more data. So we have more data around the country. And that's how these models are constantly updated. And so I caution everyone to take, a pause and understand that even if you're not in the healthcare profession, you're doing your part and it is working. But now is no time to really change course or to give up. We have to stay strong and stay true to what everyone's doing, so that us on the front lines, doctors, nurses, etc., can continue to treat, quite frankly, the onslaught of patients that we're still seeing.
Doctor, give me a sense for your grueling day. You go in at what time, and what is the first thing you see, and what is the first thing you do?
It sounds cliche, but every day kind of blends in to the next. So, a Monday and a Friday and a Saturday really are all the same. Every day has its own unique characteristics, but in general, myself, my critical care colleagues, also, we start off with the sickest patients, so those in the ICU. Those usually mean those that are on ventilators, unfortunately, and or new patients coming in through the ER, because those are the most acute, most sick, and those are the ones that we have to identify. We have to treat with either our protocols, which, as you know, include medications that are utilized usually by the FDA and approved by the FDA for other things like malaria, and use them off-label for COVID-19. We are fortunate in the tri-state area to have many excellent academic centers as well as excellent community hospitals where we can be part of numerous clinical trials. My own institution, we're part of 2 clinical trials. So every day we meet with our clinical research team, who is really, quite frankly, invaluable to us, identify those patients that may be best served by being enrolled in a clinical trial. And then, you try to go through your day, but it's really impossible to plan it because you could say, well, at 8 o'clock, I want to be doing this, 9 o'clock, I want to be doing this, and 9:15 in the morning or 10 o'clock at night, you get a call from the ER that the patient's crashing. So every day, quite frankly, is a challenge, both physically and mentally, to power through. Again, I'm not speaking just on myself. I'm speaking on behalf of the entire amazing team that we have, and all hospitals have, of doctors, nurses, respiratory techs, and really everyone down the line. I mean, the laboratory workers, the environmental people who are, invaluable for turning over the rooms and making sure that they're taking a lot of risk too, cleaning out these rooms and making sure that there's another room for the next person, because you can be sure in the ER, as soon as one patient leaves, either goes to the ICU or thankfully goes home, there's another patient waiting in the waiting room to be seen. So it's a Herculean effort, and no day is like any other. I would just say that, when we do come home, we try to unwind. We all have the anxiety and the concern of bringing it home to our families. We want to stay safe, both physically and mentally. I think this is a big mental burden for all of us to bear as well, because we see how poorly some of our patients do. And of course, the isolation that our patients are feeling and dealing with is especially heartbreaking.
Doctor, I want you to stand by because I want to talk about some of the protocols, some of the treatment methods, what's working, what's not working. But hang with me for a minute, because I want to introduce the Detroit Police Chief, James Craig, who's with us tonight from his home in Detroit. Chief, how you doing? How you feeling?
Hey, Chris, much better. I was diagnosed a week ago last Friday. Initially, as I repeated the story so many times, like so many here in Michigan, I suffered from seasonal allergies. The traditional headaches, coughs, sneezing, you name it, seasonal allergies. But I had a cough that started to linger. And as this COVID started to, spread, I decided to get tested. Got tested on a Thursday. My results came back that Friday, positive. Then I started to get the chills, lost my appetite, lethargic, didn't have a lot of energy to do much. But that was kind of the extent. And so it wasn't as bad as what you hear so many who progressively get worse. There's a lot of things I can think of as, I'm 63 years old. Not that, as it's been said time and again, this disease does not discriminate. I don't know if my level of fitness had anything to do with it, but certainly I've been fighting this thing, and now I'm at a place where my appetites return, my energies return. I've even started engaging in some cardio activity, very light, to transition back.
Well, thank God, Chief. Ironically, you and I spoke, I guess, about 3 weeks ago, and I called you on an unrelated matter on a story we were working for on a whole nother crime series. And at that moment, you were in a strategic meeting to deal with this COVID-19 crisis. When we spoke briefly on that day, did you have any idea what was about to happen to your city here in Detroit?
Would not have expected this, like so many cities across the country. But I will tell you one thing about my executive team, our staff, we always talk about the what ifs. And we started early on talking about if a number of our officers got the disease, we had to quarantine large numbers of members. What would that look like? Would we have to close police stations? Would we have to certainly take our support functions and disable them for the time being and reassign them to the patrol function, which clearly is the most important job that we do? And so all those things came to pass. We thought about it. One of the things I talked about even before it got bad, I said, it's going to hit our communications center. And when it does, we're going to have to shut it down. As you know, Chris, if you have to shut your communications system down, then how does a community member call the police? They have to call into a police station generally, the old way, and then the individual police stations have to dispatch units from the station, which doesn't really work very well when you're talking about an emergency situation. But the good news is when we opened our new $8 million communications system, I was insistent that we put a backup in place. We did that. And so when we had to shut our communications down because one of the members was COVID positive and subsequently died, we had to shut it down so it could be cleaned. And then there were others that we had to quarantine in response to that. So I would tell you, when you look at our numbers, certainly nothing compares to New York. By way of example, as of today, we've had 163 of our members test positive since we started. I think it was going back to March 13th. Right now, as of today, we have 401 sworn members quarantined. We have 106 civilians quarantined with a grand total of 507.
Now, one of the interesting things, Chief of Detroit, is that you have these 15-minute tests for COVID-19, correct?
Yes, we just started that within the last 72 hours.
And how has that been a benefit to your department and your officers?
You know, I want to applaud the mayor for going out and finding a company out of Chicago that offered this and quickly making a purchase. We can test upwards of 200 first responders a day. So it's a very powerful tool, not only to identify whether or not someone has COVID, but also when you talk about returning our members back to the job. Since we started quarantining, we've had a total of 893 members quarantined. Now, we have brought many of them back. I think the number now is at about 507. So the impact is lessening. But this rapid test, 15-minute test, is powerful, a great tool.
I don't have to tell you that Michigan is third in the country in terms of number of COVID-19 cases after New York and New Jersey, Detroit, Wayne County being the hotspot where you're at right now. What impact has this had on the city in general, your department, and why has Detroit been hit so hard?
You know, I get asked that question a lot, Chris, and I wish I had an answer. Certainly, people want to put socioeconomic issues to it. Maybe that is a part of it. But when you look at other cities, they may not have as much poverty. Does poverty play a role? I think when this is all said and done, the researchers might tell you that, you know, certainly lifestyle has a lot to do with it or could have something to do with it. You know, and I look at my own case and many of our sworn members who have a rigorous fitness program. Does that have an impact on how the disease impacts you? I don't have the answer. Does diet have anything to do with it? Resources, just don't know the answers to that. You know, one thing I have said publicly, and I will continue to say, this disease is not discriminating, doesn't matter your socioeconomic status. You know, certainly in terms of policing, it doesn't matter what rank you are. We've had a number of command level officers who have tested positive. The chief has tested positive. So who knows? I just don't know why here. There are a lot of speculations as why it's ravaged this area to the degree it has so quickly.
There was talk just yesterday, Chief, that there were roving groups of people not abiding by social distancing or any sort of a curfew. What's the latest on that, and what are you doing about it?
That's gotten better. In fact, the department, we've taken a very aggressive stand. Many of these groups, you've probably seen the videos, young people congregating in a gas station, upwards 50 to 60 people, really just not really giving much in the way of, adhering to the warning. And so we went in, started issuing citations, warnings. I mean, the tickets were $1,000. They were congregating in parks. But I got to tell you, Chris, when I look at images out of California and I see lots of individuals on beaches, I mean, who's defying the warning? And so we talk about Detroit, and yeah, there are images in social media, but then you look at what's going on in California, that maybe that's changed, but we don't have groups congregating at that level. I mean, I saw the images. Venice Beach, business as usual. And you hear very little in the media about that. But certainly when we think about Detroit, we show images of young, mostly African Americans congregating in a gas station. And so, that issue is something that we're working through. We certainly have seen a decline in that behavior, and we hope that it stays that way because we're going to take a very firm stance on it.
Chief, how's your energy level? Can you hang with me just for a few minutes?
Yeah, I'm good right now.
Okay, good. Hang in there. I just want to touch base.
If I have to get off, I'll just.
You do what you need to do, but I appreciate you being with us. I want to switch just for a minute to Vincent LaVien, who's with the Emergency Management Task Force in New York City. He's got to get on with one of the senators in New York in just a few minutes, but I want to check in with you first. Vinny, what's the latest? You've been all around the city. You were at the Javits Center today at the temporary hospital facility with more than 1,000 beds. The USS Comfort's now set up for COVID-19 patients. You've been trying to get everything from masks to food and help to frontline responders for the last several weeks. But today, what's the status out there? How bad is it? Have we hit the peak?
I think, unfortunately, the media is not allowed to get into the hospitals. We have them all locked down so they can be sterile. I think New York is experiencing something, unfortunately, we've never had to experience before. It's at the Javits Center today, and they have over 250 patients. They're going to have over, they believe, 2,000 by the end of the week. The USS Comfort was supposed to be a non-COVID-19 site, and they immediately had to switch that. So a naval ship, which obviously has other sterile issues, and all the naval staff on that ship is now going to be staying at a hotel, not staying on that ship, so they can protect, obviously the naval and marine personnel. The hospitals right now have no room in them, and that's the reason why the Javits Center and the Comfort, which were both supposed to be pop-up hospitals, meaning non-COVID ID, they're now going to have upwards of 4,000 beds, 5,000 beds ready for the spike that we're about to hit. I have to say, in seeing the positive actions, and I have to say the chief is obviously a true hero in all the law enforcement I've been dealing with. These guys get up every morning and they continue to stand in line to risk their life. I've seen it firsthand. The police, the firefighters, everybody right now has, and I have to say New York's always been like, people are very strong and they take a lot. I've seen a lot of people step up now, because I kind of want to talk about the positivity of seeing people and the great work that they've done. Today, I had to see an ER doctor that I've known for a long time at one of our biggest hospitals in New York, and I had to drop off the 3M surgical masks that are now finally coming in because they're going through literally thousands a day. And I asked how she was doing, and she's like, Vin, her husband's an ER doctor in in Brooklyn, the heart of Brooklyn, as you know, in Borough Park, which is catastrophic right now on the amount of people that are dying. And they're getting up, reporting to work every day. Their kids are being watched by her parents, and they haven't seen their kids in over a week and a half. And they get up every day, 2 ER doctors, and they're going in to save lives. I see the police officers and the firefighters. They're responding right now so quickly. Chris, I'm sure you've seen this on the news. They had to bring in the FDNY, which is the largest active fire department in the world, NYPD, largest police department in the world, a lot like the chief. We've had thousands of police officers that have COVID ID, thousands that have been called out sick, that the firefighters, the EMS. Right now, we have to bring in EMTs, EMS emergency personnel from other states, ambulances from other states. That didn't happen since 9/11. The toll right now is doubled the deaths of 9/11. So just think about that. And as you saw the days, 700 deaths within 24 hours. And the hospitals right now and the doctors, a lot of them have been working directly with John Samuelson, the president of TWU International, that represents all the flight attendants on JetBlue. The flight attendants, needed some masks. So John immediately made sure they had them, because now we're going to have, thank God, hundreds, if not thousands, of doctors and nurses that are getting on planes and coming to New York to help save lives. And
Vinny, you see this all over the city every day, perhaps like no one else, because you see it from the hospital standpoint, the police standpoint, the firefighter standpoint. What's the roughest thing you've seen over the last 24 hours?
I have to say, Chris, getting a call from a funeral director and saying that we need help and assistance. I'm out of body bags, and I need hazmat suits, and I need vital resources to take care of families, and them going to a hospital and trying to retrieve the body, and the hospital's so overwhelmed. The hospital cannot tell them where the body is. And to this day, an hour ago, when we're trying to track down to make sure the funeral tomorrow morning, they can honor, the family. The funeral directors right now are people don't forget, they are first responders as well. They're putting themselves at risk and honoring these families that can't have a funeral mass, can't have a wake, can't go to the temple, can't have a religious service. Within New York, we have to have a memorial service graveside with 10 people. I mean, think about that. Your family.
Did you ever think, Vinny, that we would see as many portable morgues and trucks and bodies in the city of New York? We're now, when you look at the statewide figures, we're more than double than 9/11. Did you ever think we'd have to cope with something like that? And what's it like when you make your rounds to try and satisfy the different needs of all these frontline people that you're trying to help?
I worked down at Ground Zero, Chris. The last time I saw D-More, the last time I saw our office with our medical examiner have, tractor trailers of refrigerated trucks, was after 9/11. And this dwarfs that. The amount of services that we have right now in New York City. I got a call today from two funeral directors that they want refrigerated trucks outside their funeral homes because the amount of people that they want to help their families. I have to say the positive thing, and I kind of want to go into a positive component here because there's so much negativity. I have one person, just to tell you an amazing story. This guy, Adam, who I got connected through the Chainsmokers, right? Very big act, through Barstool Pizza. He owns a lot of pizzerias in New York City. And they contacted me and they said, he wants to help. So I'm all right. He said, Vin, can you help me get into hospitals? No problem. So we called NYU Langone, Cal Langone, a lot of the hospitals. And this guy kept open his pizzerias and started dropping off pizzas about 3 weeks ago. He's up to 40 hospitals, 8,000 pizzas. I brought him into the Javits Center today. He's now feeding all the Army personnel. And here's one person that could have stayed home, could have, taken it easy, gone out to the Hamptons, gone on that beach that the chief was talking about in Venice, act like nothing was happening. He rolled up his sleeves, and he's helping the people that are on the front line saving lives. He said to me today, he's like, Vin, all my friends are out in the Hamptons, and they're all enjoying life, and, here I am helping people in need. And I said, Adam, that's something you'll never forget the rest of your life. He hasn't seen his son, his 6-year-old son, in 3 weeks. And he every day wakes up. He has 5 restaurants. They make these pizzas, and to see the faces of the doctors and the nurses as he comes in, dropping off these pizzas every day. We're up to 45 hospitals, firehouses, police departments, and now I'm sure you've seen on the news. But the most beautiful thing, the firefighters that risk their life, they're showing up at the hospitals during shift change, and there's hundreds of firefighters in their fire trucks, clapping as those doctors and nurses are leaving their hospital after a 12:50 hour shift. There's police officers thanking them, and I think this is really something. The positive component here is doctors, nurses, firefighters, police officers, seeing the Army, the 69th, the Fighting 69th, which is an amazing military force on the streets helping. They're at the Javits Center. They're now reporting to hospitals. I've seen, military helicopters now flying into New York City. JetBlue is landing. Thank God for JetBlue is donating their airplanes for doctors and nurses coming in. The positive thing of here, and I showed after 9/11, is volunteers, people that are stepping up, that could be staying home with their families, helping in ways that is a beautiful thing to watch. And I think that's something that New Yorkers will never forget, that in our time of need, I've seen doctors coming in from Kansas, Arkansas, Montana. They're leaving their families and they're saying, I got to get on a plane and I got to help save lives, knowing that their life is in jeopardy. That's a beautiful thing. And Chris, I'm trying to tell positive stories right now.
No, I understand that, Vinny. I think that's great, which I appreciate. I know you got to jump off and get on this call with Senator Charles Schumer to coordinate some more of this stuff. I appreciate you being here. God bless. Take care of yourself, and we'll check in as this continues. It's a long way from being over, but thanks for doing your part. I appreciate it, Vinny. You have a good night.
Thank you, Chris.
All right. I want to go back to Chief James Craig for a minute while we have him here. Chief, when you take a look at this, and again, we're all in uncharted territory here, what are the lessons in terms of dealing with a crisis, in terms of leadership and facing up to something that is so overwhelming? It's almost like you couldn't have predicted this in any sort of an emergency exercise or drill.
It's funny you mentioned that, Chris. That's something I've given a lot of thought to. When I look past my now 43 years in the profession, I've been through a lot. I spent most of my career in Los Angeles, certainly gone through earthquakes, civil unrest, the Rodney King issue and the impact that had between the community and police. And while those are major undertakings, and there are books on it, on how to respond, who would have thought that one day we'll be facing a pandemic? And to the degree that we're dealing with this invisible enemy. I will say, though, that when you look at any emergency, whether it's 9/11, a civil unrest on a large scale, planning and preparation works. And even though the known issues surrounding what you're fighting, this is very different. You still have to go into that mode of being proactive, responding. As I oftentimes, my staff hears me use this phrase, speed of execution. Being able to make a quick assessment and respond. As I indicated earlier, when you look at our communications by way of example, you have to talk about the what ifs. And when you talk about the what ifs, you then can plan for the worst case scenario. The other thing, as I've said to my colleagues in other cities, is that there were other cities ahead of us in terms of law enforcement response to this crisis. For example, we knew that in Los Angeles, the cars were being disinfected every 2 hours. And we hadn't started that effort, but we weren't quite where we are today. So we started doing that. So knowing what's going on, we had a chance to adopt best practices so that we could, respond accordingly. And now, as things turn out, we are one of the flagship police departments in responding to this crisis. I will tell you, when you talk about the number of people that have been quarantined inside our organization, with the exception of New York, of course, people are trying to understand how and why we respond like we have. And so that's very important.
What's your biggest challenge, Chief, in the next 24 hours here?
Continue to assess our staffing, because what we haven't done, we haven't had any interruptions in service. Certainly keeping our members safe. As we talked about in the last segment, we talked about the value associated with the rapid testing. This way we're able to, get officers return to duty much quicker, and also take those out of service that test positive. But then it's more than just that one officer, because when there's one officer, how many others are impacted when you start going through and looking at. The other thing that we've done quite well has helped us tremendously. We have a physician assigned to the police department, first responders, both fire and police. He's been very helpful in our ability to make quick assessments on other members that may have been impacted.
And what about the crime rate during this? We hear so much concern about domestic violence because people are cramped in together. We hear about crimes of opportunity, even in the most dire of social circumstances. What is happening as we speak, Chief, in the city of Detroit?
Initially, we saw a drop off on violence, particularly homicide and shootings. Over the past 4 days, 3 days, we've seen kind of an uptick in shooting incidents, normal stuff. And so what we did, we saw an uptick at the beginning of the year, and we believe the violence in the city was associated primarily for crimes occurring during the sale of black market narcotics, primarily marijuana. And so we saw shootings, whether it was a seller who was armed or a buyer that was armed. And so those things erupted very quickly into violence. And so that kind of, we put and this again is pre-COVID, we put some strategies in place that were very effective. We started to see a decline. COVID hits. We did see what appeared to be some increase in argument-based violence, domestic violence incidents, and that's kind of leveled out as well. But right now it's unexplainable to see why over the last several days we saw a little uptick in shootings and homicides.
All right, Chief, listen, I know you're still recovering. I know you're fatigued. I can't thank you enough for joining me tonight. You stay well, stay healthy. I assume you're going to get back to work pretty soon here, as soon as the docs let you.
Yep, looking forward to it. Thanks for giving me an opportunity to talk on your show.
Thank you, Chief, and God bless. Appreciate it. You have a good rest. All right. Dr. Saggar, let's get back to you now in the treatment of these COVID-19 patients at your medical center, Holy Name there in Bergen County, New Jersey. Do you have everything you need? Do you have the ventilators and the things that you want and need? I mean, obviously, nobody's got everything they need in this kind of a crisis, but are you getting by okay?
We are. Two paramount issues. One is PPE, or personal protective equipment, right? We have to keep our first responders safe, as been mentioned previously. And through planning, through generous donations, etc., we have been able to stay well equipped and ensure that all our first line responders, all our healthcare workers, all our hospital employees that are directly involved or even indirectly involved with patient care have enough PPE. We're very fortunate for that. In terms of events, this is something that we are constantly reevaluating. As of now, we are still staying ahead of the game. Again, it's the whole idea of the race, but it's not a sprint, it's a marathon. So we have to constantly keep ahead, and we're ahead today, but we can't be complacent. We have to constantly reassess. Do we have enough vents? Do we have enough rooms? Do we have enough therapists? Do we have enough critical care doctors? So it's not just the idea of having a ventilator. Do you have the space for that patient? Do you have the expertise? And the expertise is through critical care doctors, through respiratory techs, through anesthesiologists who oftentimes intubate these patients. So the answer to your question is yes, we are staying ahead. We are winning that race, but we're always in the back of our mind, worried that if the surge continues at some point, we may not be able to stay ahead. So it's something that we cannot rest on our laurels. We have to consistently reevaluate and take stock of.
Can you see any light at the end of the tunnel as we speak tonight? Is it too early to even say that, or are you cautiously
we have to have hope, right? So, I mean, hope in the sense that we're sharing information. Let's start broadly. Sharing information globally, sharing information nationally. There's probably never been such a concerted effort from a scientific and medical community working on one single disease process or infection. You know, the fight against HIV is probably something that also comes to mind. But you're having people look at vaccines. We're looking at old medications and repurposing them for new indications. We're looking at experimental medications. We're sharing information. We're publishing data as soon as we can get it. First, it was China and the quote unquote Chinese experience. And now United States, of course, has the distinction of having the most cases in the world. So now we are it's our responsibility to take the data and take the information, publish it, make it readily available. So I would say broadly, the ability in 2020 to disseminate medical information so quickly and so broadly is very encouraging. And that does translate into initial preliminary results and what we hope results down the line. That's the good news. The caution, of course, is that no one treatment or medication has proven to be the panacea that, you know, some in the media and some politicians may express or hope. We all hope that one particular medicine may be the cure, but that's not the case by any means. We're seeing that this is a very tricky foe. There's several phases of this virus. There's several types of manifestations. So we all know it can cause pulmonary or lung issues. We're learning now it can affect the central nervous system. It can affect even our skin. It can affect our gastrointestinal system. And then also the elephant in the room is we don't even know what the long-term effects on patients who recover may be. So while we have a lot of hope and we have a lot of at least initial early results that makes us optimistic, by no means is this over. And by no means can we be complacent. And by no means can we really just let down our guard. This is truly a marathon. And I know it sounds silly to give that kind of analogy, but it truly is. And we have to look at it as such from both the medical community as well as from the general public, who have to essential to continue with their social mitigation, social distancing, which really
as chief of infectious diseases, this is your specialty. Did you ever think in your entire career you'd be dealing with something of this magnitude?
No, I would be lying to you if I, could have foreseen this. But what I will tell you, and I'm nothing special, that all infectious disease doctors, all doctors, epidemiologists in general, are always thinking and understanding that if you look back at history always repeats itself, right? So I joke and tell medical students that bacteria and viruses were here long before we were, and will likely be here long after we're gone. So if we look back in history, epidemics, outbreaks, pandemics have always occurred. And we always would be foolish to expect that it wouldn't occur at some time. So I couldn't have predicted necessarily what happened in 2020. It would happen with what we call beta coronavirus. But I would say that all of us know that this always a matter of time. It's never if, it's just when this will occur, which really just lends itself to understanding why it's so important to keep basic research well-funded, to always have a proper preparedness and pandemic preparedness facilities, both at the federal, state, and local level, well-funded. This is something we can't escape, Chris. I mean, this is, we don't live in a vacuum. We live obviously with bacteria, with viruses. And as we continue to encroach on different animal habitats, et cetera, zoonosis, which means a virus that initially started in an animal and then suddenly jumped to a human, will continue to happen. And we have to be aware of that. We have to understand that. And this most likely will not be the last in our lifetimes, quite frankly.
You mentioned earlier working with some of these drugs that are on the market, but experimental for the treatment of COVID-19, hydrochloroquine being one of them, used in among other things, anti-malarial treatment. Are you using it? Are you seeing anything? Is there anything anecdotally that suggests this is working for some people in your care?
Yeah, so chloroquine has been used for many years for malaria. Hydroxychloroquine is a safer metabolite, we call it, of chloroquine, and is used for things like lupus and rheumatoid arthritis. We are seeing some modest yet still positive effects if used early. And I alluded to earlier that there's really two phases to the disease. There's the initial 1 week to 10 days where the virus is replicating and people have various symptoms, either gastrointestinal, a cough, a fever, a headache, etc. And then there's the second, more deadly phase, what we call cytokine storm, which has been talked about a lot in the media. And essentially, that's the body's response to the virus. And when that occurs, it's like a paradoxical result. The body is so overwhelmed, it throws everything in the kitchen sink to fight the virus and inadvertently damages the lung. So at that phase, we're learning that no, Plaquenil, Z-Pak, or Zithromax, giving a high dose of zinc probably doesn't have much of effect. And in that phase, we're looking at other medications that may blunt the body's own immune system that's causing damage to the lungs. And so we're looking at something called monoclonal antibodies. That's a fancy word, but essentially something that binds a cytokine. That's where the cytokine storm comes in. Something specific called interleukin 6. There's drugs out there that are used for rheumatoid arthritis, lupus, other autoimmune disorders. So we're trying to take these drugs that are FDA approved for something else and using them off label for COVID-19. Of course, you probably have heard about, and your listeners have heard about the serum. So basically we call convalescent serum, people who recover and have antibodies. Why not give those antibodies to people who are critically ill? And there are studies, not in my own institution, but in New York City and in Bergen County and other institutions, they're looking at that. So there's a whole host of interventions that are being looked at. And really, they're all trying to buy us time until we eventually, and hopefully within the next 12 to 18 months, come to a more definitive solution, which would be, of course, vaccination.
What does the next 6 months look like to you, Doctor?
Yeah, it is unclear, and there's a lot of questions. So unfortunately, I have more questions than answers. Things could slow down. One, because of social distancing, also because of the summer months and the more warmer temperatures and humidity, which for various reasons may, not definitively, but may cause the virus to be less likely to be spread from person to person. Our great fear, I think, in the scientific and medical community is people becoming complacent, social distancing measures being relaxed, and then subsequently in the fall and winter of 2020-21, this coming back with a vengeance, either as a new strain due to mutations or infecting more people who haven't been infected previously and have no natural immunity. So there are a lot of unknowns. People want to look, when is the date we can go back to work? What's the date we can open up the country socially and economically? And the reality is it's still not clear. What is clear, to use a double negative, is the uncertainty that this virus has posed to us. And I think it'll be quite some time before we can truly say, and just like Anthony Fauci, who was essentially the top infectious disease doctor in the land, has said that things may not return to normal in all regards for a very long period of time. And what I think he means by that is that there will be a constant, in our back of our minds, a constant issue or thought that this virus may come back at any time, especially in the fall and winter. And it's unclear, again, if people who have recovered now will have immunity for a future infection. It's unclear if future infections will be more virulent or less virulent than they are now. And it's unclear, how it will spread throughout the rest of the world, the Southern Hemisphere, for example. So there are a lot of unknowns, and that obviously causes anxiety for the general public. And of course, quite frankly, it causes anxiety for us as medical professionals.
What do you fear most as a doctor?
Well, I fear a lot of things. I think just by nature of what we do, and again, all first-line responders, policemen, firefighters, EMTs, etc. We understand what we're getting ourselves into, but we do see the worst of the worst outcomes in many regards. I would say the biggest fear, and I think a lot of my colleagues will probably echo this, is really the seeing patients having to suffer alone, in many instances die alone. There've been, I'm sure you've heard tragic stories of nurses, even doctors, FaceTiming loved ones, myself included as patients pass. That's probably the hardest thing and one of the most terrible things I've ever seen and had to deal with.
Tell me about that. You had to do that in
one instant, yes. Obviously, respect patients' privacies. I would give very general issues, but we know that almost every hospital is not allowing visitors in, so patients already are alone. They're relying, thankfully, on technology to communicate with family, FaceTime, Skype, Zoom, whatever it might be. But in some very tender and terrible moments, families are requesting to be there at patients' last breaths and last moments on this earth. And it's a privilege to be able to do that, but it's a terrible privilege to have to bear.
I can't imagine the emotional cost this takes on you to have to hold a phone or to orchestrate a FaceTime between a patient who you desperately and valiantly tried to save and connect those last moments of life with the family who can't be there.
No, and my hat's off to all the nurses out there, because at the end of the day, oftentimes it's those nurses who are having the most burden. I won't say burden, but having the most difficulty to bear in those last moments, along with physicians and others. And quite frankly, it is taxing mentally. When people always ask me, for instance, family and friends, how are you doing? I very thankfully, and I was touch wood, say physically fine. But mentally, I can only imagine in some regard, this is what PTSD feels like. And that's across the board, which is why I tell all my colleagues, and my colleagues tell me that, you have to take moments out of the day and reconnect and try to mentally clear your mind. It's not easy. Coming home, you try to disconnect, but it's not easy. You try to spend time with family as much as you can. But of course, in the back of your mind, you're constantly worried about bringing it home. So myself and many of my colleagues included, you sleep in different rooms, you take showers in different bathrooms, you take off your shoes and clothes in the garage, and you bleach everything nonstop, and you hope that it doesn't follow you home. So I think there's a lot of anxiety, from the moment you get home until you get up and then go back to work every day. I usually, when I get to work, my own way of handling is I get into the garage and I drink a quick cup of coffee in the parking garage of the hospital. I listen to some music, and then it's go time. And that's with every doctor, nurse, and other first-line responder. They're all dealing with this, and it is incredibly difficult. And I hope when this is over that everyone then takes some time for mental health as well.
As a husband and parent, what's your greatest fear, doctor?
Oh boy, I don't. We all want to keep our children, our spouses healthy, and one, make sure they don't acquire it. So, keeping them home, social distancing, obviously following all the rules, and just trying to make sure your child's happy in this unprecedented time, and taking any anxiety away from them. But I would say for all physicians, nurses, the biggest fear is just, having a slip up and bringing something home. So, my wife will joke, we try to joke around a little bit, but when I come home, I bleach everything in the garage. I bleach the doorknobs, and, I wear scrubs to work, and then I change out of my scrubs and put new scrubs on, but I hang them up in the garage. And, we joke and say I do the full Monty in the garage of taking everything off and going to run and take a shower before having dinner and talking to the family. But I know that I'm not unique in that way by any means. That's something that runs across all my colleagues' minds, and I think does invoke a lot of emotions when we're home away from the job. And of course, when you're in the hospital, you don't really have time to think. There's just so much to do. But of course, we have to always remember, when you're rushing through from patient to patient, you're dealing with 10 different things at once, that we have to keep ourselves protected. So, we constantly reminding ourselves, do you have your goggles on? Check, make sure your gloves are on, your gown, making sure that after you take everything off, you're washing your hands numerous times. You're not touching your face, you're not touching your nose. So we really support each other the best we can. That there's no other way to say it. I've never seen that level of support before amongst all levels of healthcare workers throughout the U.S.
When you look at the severe cases, the ones you're dealing with, is there one thing these patients have in common? Can you derive anything from this at this relatively early stage of this pandemic?
Well, the chief actually articulated very well his own observations. His own observations have been some of our observations. We live in an evidence-based world, so of course, to make any far-reaching conclusions, we'll have to take the data, look at it scientifically, seeing if there is statistically different or meaningful differences in different patient groups. But From China, we looked at older age and chronic comorbidities. That means things like diabetes, heart disease, stroke, kidney disease, lung disease, smoking. We very quickly in our own institution and throughout talking with many of my colleagues, other institutions as well, saw some other correlations. We saw that males in general had more severe disease. We do see an association with obesity. There's some medical reasons for that. There could be other genetic variations. I mentioned, I think to you before, is that China is a very homogeneous society. We, of course, are the great melting pot. So by definition, we're great because we have so many different ethnicities and people with different backgrounds here. We surmise in our studies looking at certain genetic predispositions for people that have very severe disease. You can have people in the same household. One maybe has a little cough and sneezing and fever for a couple of days and gets better. And we've had others where the spouse has severe disease and even death. Is that because it's a male? Is that because of their ethnicity? Is that because of medications they were taking? Is that because of their blood type? These are all things that are being theorized, but I would be foolish and foolhardy to really say any one of them are definitive. I think we're collecting the data, and only after this, a long time has elapsed and we're able to look back retrospectively and analyze the data, can we make really definitive statements. But these are some things that are coming to light. One is obesity, and one is actually males, the male sex. We're looking at estrogen, at least theorized, to perhaps have a somewhat protective effect. But again, we have plenty of females, patients, unfortunately, who also have very severe disease.
And when you look at age, a lot of questions have surfaced about why does a normally healthy young male, 19, 20, 21 years old, have such a hard go with this, where somebody my age or your age could get through it. Might be painful, but we'll get through it in all likelihood. Is that because of vaping? Is it because of some other outside influence? Can you even draw any correlation at all at this point?
We can. So you mentioned vaping and smoking. So certainly that in of itself is indeed a risk factor, but it's almost paradoxical. But in general, males have a very strong and vigorous, what we call adaptive immune system. So females may have more of a stronger innate immune system, but the adaptive is when your body says, okay, hey, now we got this virus. We have to activate something called B cells and T cells and really throw everything at it. And that's why we surmise that some males who are otherwise very healthy and very vigorous, because of that very vigorous immune system, it essentially goes in overdrive. So imagine dominoes. That's the analogy I use, dominoes falling. The dominoes just start falling and continuing. And someone who may be older and have a less vigorous immune system, their immune system may, not really cause any significant damage to the lungs. Paradoxically, those who are who are younger and perhaps have a more what we call robust immune response may end up damaging their lungs, in some cases very severely. And so that's the disconnect that we see. We see it's not just, I want to be clear, it's not just obese, diabetic, out of shape, vapors and smokers in their 30s and 40s who are the ones that are at risk. We've all heard stories, tragic stories of 20s and 30s and very excellent shape and athletes, former college athletes with no particular vices, having very difficult clinical courses. And that is something that's being looked at, and that's something that will continue to be looked at. That along with genetic variations. But the idea of the very robust immune system paradoxically causing a significant inflammatory response. So really throwing everything in the kitchen sink at the virus, causing damage to the lungs. And it's that damage to the lungs that leads to a whole host of other issues, including requiring, in some cases, ventilator support.
When you look at China, Italy, Spain, the UK, what does that tell us here in the United States?
I like what the chief mentioned before he got off, where he said this doesn't discriminate. We know early on there was oftentimes some very ugly comments about the virus and the name of the virus. And myself and my colleagues said, look, this has no caste, creed, or color. This is an equal opportunity virus and an equal opportunity infector, and an equal opportunity harbinger of, in some cases, death. So I think that's really something to really keep in mind as we go through this. Now, the chief did mention something about Detroit and other inner cities and and perhaps in association with socioeconomic differences, that is very much a possibility. We are seeing some early, we call epidemiological data, to suggest that those most disenfranchised, so oftentimes minority communities who, for one, cannot necessarily self-isolate. They may be, it's easy to say use a different bathroom, different bedroom, and just stay in your house. But if you're in a one-bedroom apartment with one bedroom, one bathroom, and sharing with a family, it's very difficult to do that. It's easy to say stay at home and don't go to work. But if you're living paycheck to paycheck and you're in a job without benefits, and if you don't work, you don't get paid, it's very difficult to tell people to stay at home. I think this really is opening up a window into the healthcare disparity in this country that does exist. So I really like what the chief said in terms of not discriminating, and really, I would just add that yes, no caste, creed, or color with this virus.
Dr. Suraj Saggar, thank you so much for being with us. I'm going to let you get back to a late dinner, your family, and everything else. Thank you very much for being with us tonight. I know your time is extraordinarily valuable. You've got to be fatigued and emotionally wiped out. Your final thoughts tonight before we say goodnight.
Just for everyone, the reason I appreciate you, Chris, doing these live streams is really to keep everyone educated. I've said it before that this is the first pandemic in the era of social media. So I want everyone, all your listeners, to really appreciate the fact that you're bringing on a whole host of people to discuss the different aspects of this pandemic, but also anyone out there to really, vet your sources and really trust and understand where you're getting the information, because as in many things in life, there's a lot of misinformation out there. And then the reason I like to come on, when I can and do these types of programs is really just A, keep everyone informed, but B, not for everyone out there not to give up hope, to stay optimistic, and to understand the end of the day, with everyone doing their part, from anywhere from healthcare providers to those, the general public, doing social mitigation, social distancing. It's all equally important. If everyone does their job, we will certainly get through it.
Well, we're all very lucky to have you, and I appreciate I can't do the job without folks like you who know what they're doing.
Thanks for having me. I appreciate it.
All right, get back to your family, Doc. I appreciate it. We'll talk to you soon.
Good night. Thank you, Chris.
Good night. And speaking of really taking a look at all aspects of this, we're also very fortunate tonight to have Alicia Kozak with us, who's an internet safety expert and a abduction survivor who I've known for a number of years and worked together on a number of projects. Alicia, how you doing? Thanks for being on tonight.
Yeah, I'm doing great. This has been such and it's just so inspiring to sit here and to listen to all of these experts and hearing them being vulnerable and so honest. And we have to remember that while they are superheroes, they are not superhuman.
Well, that brings up a good point. And as you know, and I know, and anybody who's in a home with their loved ones and children, and we're communicating, we're living on our laptops, on our desktops, with the internet. In some cases, it's slowed down in entire cities because of all the internet activity. What do you tell folks based upon your experience, all the experiences you've had in terms of being an abduction survivor, all stemming from internet activity? What do you tell parents and younger folks, students alike, who are spending so much of their day on the internet? There's so much to say, but what are your top few things that you want people to know to really stay safe online?
Well, when I first heard that schools were closed and that children were going to be home, I immediately thought of the fact that they are now more vulnerable than ever to cyber dangers. The fact that they are home and the predators are also home, and they're spending so much time online. We all are spending so much time online, and we're all trying to navigate this sort of new world that we have been thrown in. But kids are feeling confused, they're scared, they're angry, and most importantly, they're really bored and they're lonely, and they've been separated from their friends and their routine. And that makes them vulnerable. And predators are looking for vulnerabilities to exploit. And while children are always vulnerable, now they know what buttons to push. And I don't want to add another thing to be afraid of. And we feel like we have so little control right now. There's so much uncertainty and confusion, and none of us really know what's going on. but that we cannot ignore the safety of our children online who are home, they're online, and they are using this to stave off boredom like we all are, and they may be less supervised because the parents are working and everybody is doing the best that they can, but we still need to make this a focus.
Just today, Alicia, I received something from a viewer, follower, talking about a website where adults are being paired with known underage gamers to have interaction, gaming interaction, social interaction online. And I've seen a lot, online, and investigated a lot and busted a lot of folks, but that shocked me. And again, not illegal necessarily, but that's just one example of so many opportunities for kids to get taken advantage of at a time when, everything from schooling to social activity to gaming activity is taking place online. Nobody's leaving the house.
Exactly. And we definitely have to add in the gaming systems to that. Often that is an area that is ignored. Parents think, okay, well, my kid's just playing a game online, and they don't realize that that is a really effective way to groom a child. But you do have control and you do have power. This is not about fear, it's about empowerment. It's about giving the tools, providing the tools to you as a parent and a guardian, and to the child so that they can protect themselves. And there's a number of things that you can do. So one of the things that you must do is you have to monitor what your children are doing on their computers, their laptops, their tablets, their gaming devices, their phones, all of it. If it can get online, they can have access, and a predator can have access to them. So to monitor what they're doing, know their passwords. And yes, I get it. It may feel like you're invading their privacy, but it's not about that. It's not about catching them in something. It's about protecting them. The second thing, and this is so important, this is what is absolutely critical, is that you let your child know that they can come to you with absolutely anything at all and you will not take their device away. I've spoken to tens of thousands of children over the years, and so many of them will not tell their parents when they are being threatened online or possibly exploited online or cyberbullied online, because they're afraid that their parents will say, okay, well, I'm going to take your device away because that will protect you. Don't do that. Right now, that is their only connection to the outside world. You need to let them know that they can come to you. Also, really tell them that they can come to you. Tell them that I know there's a lot going on in the world. This is a really scary time, but you can still ask for help. Yes, we are all overwhelmed right now, but you can still come to us for help. And that's what this is about. Again, it's not about getting them in trouble, taking their device away, but you do have to stay on top of this. This is an opportunity maybe you haven't had before to sit down with your child and to talk about internet safety and to play with the different applications. Say, hey, what is TikTok? What is this? Make a video, whatever. Have fun with it. The internet is not bad. We are all surviving with it right now. It is incredibly important in keeping in touch with our loved ones and doing our work. It's a necessary tool, but we have to be able to use it safely. And we all have to be careful.
One of the points I would imagine is not only are we all in isolation, but we're in isolation within isolation. So I'm down here doing the show. There are, kids, older kids, theoretically out of the danger zone, but in individual rooms with their faces in the glow of a laptop. And I guess when the kids are younger and more vulnerable, you got to knock on the door and say, hey, what are you doing up there? As much as you may not be a welcome visitor.
Absolutely. And when it comes to internet safety, where a child may ask questions about sex or drugs or other areas, they may not bring up concerns about internet safety. That is a conversation that you have to start, and start it as young as possible. Be age appropriate. It's not about terrifying, but we teach children to look both ways before they cross the street, to not touch that pot because it's hot, to wear their seatbelt. And the reason we do that is because they may get hurt. We're comfortable telling them that they may get hit by a car, but we're not comfortable telling them that they may be exploited online or somebody may hurt them online. We have to have that same level of comfort. And again, you can't you can't protect yourself from what you don't know is dangerous. So we have to tell them that this is the danger. Here's what you can do to protect yourself. One thing that I tell kids is that they have so much power to protect themselves. And when it comes down to it, they really are in some ways alone in this world when it comes to that. It is their decision to continue that conversation, to report that person, to send a picture, to walk out of the house and meet somebody. It is their decision. So we have to teach them and give them the tools so that they can make good, healthy decisions online and off.
You know, here's something I wonder about, Alicia. We talked with the chief about concerns over domestic violence spiking during a time like this when people are cooped up beyond normal limits. Do you worry about the same thing happening with cyberbullying, given that people are somewhat cooped up on the internet and it might be their only ability to get out of the home, and at least metaphorically, metaphysically?
Absolutely. It might seem that the world is on pause, but COVID-19 did not stop that didn't stop the evilness that is going on in the world. There's still a lot of criminal acts being done. There's a lot of abuse, domestic violence, sexual exploitation, cyberbullying. It's happening, only now it's somewhat hidden. Whereas before, children had the ability to ask for help, for it to be noticed, to be seen maybe by somebody, not just the parent, but maybe a friend would report it or somebody at the school would report it, that somebody would notice it. So now it's much easier to hide. And when it comes to child sexual abuse, so often, unfortunately, the perpetrator is somebody within the family. So now we potentially have children left home alone with their abuser. And I hope that they know that they can still reach out for help. I'm so concerned that there's these kids who don't know that they can pick up and call 911 right now because the cops are busy. And they need to know that that is still an open avenue. And I hope that they reach out and that they seek help. The world is not too busy to still protect you.
Very good advice, Alicia Kozak. Final thoughts tonight from you?
We all just have to be so careful. I don't want to add another thing to be afraid of, but it is happening. We cannot ignore it. By ignoring it, we allow it to hide. And evilness really thrives in secrecy, and it tries to remain hidden. So we cannot let it hide. We have to face it. We have to recognize that this is a danger, and we have to step up. And this is a wonderful opportunity to do that, to have those conversations with your child. If you haven't talked about online safety, now is a great time to just sit down and talk about it.
Well, listen, thanks for talking about it with us, Alicia. I appreciate it. I'm going to let you get back to your family there, and thanks again for being on, and I'm sure we'll talk to you very soon. Have a good night.
Thanks so much, Chris.
Wow, a lot of information to take in one program. Alicia Kozak, internet safety expert, Vincent LaVien, Emergency Management Task Force, Detroit Police Chief James Craig himself, a victim of COVID-19, thankfully on the mend. Dr. Suraj Saggar, all of these people, I feel a little better tonight, quite honestly, knowing that folks like this are involved in fighting this pandemic, something that I've never seen in 40 years of reporting. And just to put it in perspective, I remember on 9/11, which I thought would be the worst thing I'd ever cover in my life. And it's different, granted, but you're talking about numbers in New York now that are more than doubling that, and some staggering numbers. Although I did see today, and I think there is some reason to take away some optimism here, is that anecdotally, at least, if the trends seen today in New York, New Jersey, Michigan here, where I'm sitting tonight, is not really at the peak yet. It may not be for another couple of weeks, according to what came out of the governor's office today. But at least you're starting to see fewer people come into the hospital. Deaths continue to go up. It'll be interesting to see what the numbers are tomorrow, and I think that'll be a good indicator. But thank you for having a seat with me tonight. I hope wherever you are safe and healthy, and your loved ones are safe and healthy. If they are not feeling well, don't take any chances. Get some medical help right away. Have a pleasant, peaceful evening, and remember, I'll be watching, and I'll see you back here tomorrow night when we'll continue our investigation into Greg James Jackson Onision, as well as David Vanity. A very, very impactful show tomorrow night. And I'll be talking about that on social media tomorrow. In the meantime, have a pleasant evening, as I said, and I'll see you tomorrow night right here on Have a Seat with Chris Hansen. Good night.